Hello, I am Dr. Garusinghe, one of the endocrinologists from Sri Lanka. I want to tell you about there are numerous myths about diabetes that are too commonly reported as facts. These misconceptions of misinterpretations of diabetes can sometimes be harmful and lead to unfair stigma around the condition. In today's era of internet and smartphones, there is plethora of misinformation that circulates. But not all are true. It can be hard to know what is accurate. So here we aim to highlight the facts for several common diabetes myths. There are numerous myths about diabetes that are too commonly reported as facts. These misinterpretations of diabetes can sometimes be harmful and lead to an unfair stigma around the condition. In today's era of internet and smartphones, there is plethora of misinformation that circulates. But as you know, most of them are not true. It can be hard to know what is true and what is wrong. So we try to explain few myths that most of us have about diabetes. Other myth is that women with diabetes can't bear children, which is not correct because diabetes is a very important illness when it comes to pregnancy. So 1 in 6 pregnancies are complicated with diabetes, which can be pregnancy-induced diabetes or pre-existing diabetes. But it is true that when you have uncontrolled diabetes during the pregnancy, the risk of miscarriages, the risk of abnormalities, they all go up. But on the other hand, if you are a diabetic, type 2 diabetic or a pre-existing diabetic, and if you plan pregnancy, you have to control your blood sugar very well. So if you conceive when the blood sugar is very well controlled, then the risk of diabetes is much less on the child. Similarly, in the pregnancy related diabetes or gestational diabetes, if you control the blood sugar very well, mostly with insulin, then your child will be perfect, normal. There won't be any issue. But the good news is the people who get this gestational diabetes, most of them get totally cured of diabetes when the pregnancy is over. But the thing is, they are still at high risk of developing type 2 diabetes later in the life. So they have to be very careful with their diet. So by controlling their diet and doing exercise, they can avoid getting type 2 diabetes later on in the life, and also they can prevent getting diabetes for the next pregnancy. Another myth is that some natural products are there which can control or cure diabetes. But to date, there is no such product which can cure diabetes. As you know, it's a progressive illness and you get diabetes due to your poor lifestyle habits and various other factors, and once you get the diabetes, it stays with you. You can control it. So if you control it with diet, exercise, medications, it can be tablets or it can be insulin or whatever is necessary as decided by your doctor. If you control according to his instructions, then it is as good as curing diabetes. Another myth is people with diabetes should not play sports or do exercise. There's nothing like that. When you have diabetes, it doesn't restrict you from doing any of your usual day-to-day activities. You can do exercise, and actually you have to do exercise. An adult should do exercise at least 150 minutes per week, and the child should do at least 1 hour of some physical activities a day. So doing exercise is actually complementary for your medications. So you can be on less number of medications and lower doses if you do exercise and control your diet. As you know, there are very prominent celebrated sportsmen who are diabetic. Some have been diabetic from the small age and some have been on insulin, but they have still performed very well in sports. So diabetes is not a hindrance for you to do any physical thing, anything deviated from the normal life. Another myth is that people with diabetes cannot drive. So there is nothing like that. So if your diabetes is well controlled and if you are not prone to hypoglycemia, then you can drive normally. But there are patients who are on insulin, and there are people who are on insulin and they have increased risk of hypoglycemia. So hypoglycemia is the problem. So if it occurs, there is a slightly increased risk of facing accidents due to loss of consciousness and hypoglycemic effects on your vision and the mind and everything. So therefore, those who are on insulin have to be very careful before they drive. They ideally should check their blood sugar, and the blood sugar should be in a good range. I have borderline diabetes and I don't need to worry, which is not true, because when you have borderline diabetes, that means you have a great opportunity to avoid diabetes. So that means you have to work hard, do exercise, control your diet, adopt very healthy lifestyle, and get rid of developing diabetes. So if you don't do that, if you think that okay, my blood sugar is only slightly increased, I am still not diabetes, then you are going to get it sooner or later. So the best thing is, when you know that your blood sugar is slightly elevated, you have to think that you are a diabetic, and you have to control your diet and do exercise and do regular checks and check the blood pressure, check the cholesterol, keep those numbers under control. Another myth: my doctor put me on insulin, that means I have not taken care of my diabetes, which is not correct, because type 1 diabetics anyway needs to be on insulin. There is no other option. But when it comes to type 2 diabetics, most of them are on oral medications, but there will be a point where the oral medications fail because of the progressive nature of the diabetes. Even in type 2 diabetes, the insulin level or the insulin reserve in the body goes down with time. So there will be a time where you need insulin to keep the blood sugar normal. So at that moment, your doctor will introduce you to insulin, which is a good thing. So that doesn't mean that you have failed, but it means that you are trying to keep the blood sugar well controlled.